I really encourage patients to come up with their desires, the way they hope things are going to go, and then discuss it with your physician, because there may be some misperceptions on that birth plan that you would like to have that really aren't safe for the baby or safe for you. And I think that's a great conversation to have well before you're in labor, because when you're in labor, it's very hard to focus on the birth plan.
Okay.
So that would be my recommendation.
Okay, so now that we are in labor, you have to learn how to manage that labor. So we're going to bring in Tara Schuler, who is a childbirth educator here at UNC REX. Tell us about this big blue ball that you've got here.
Great. Well, speaking of birth plans, and one of the things that we like to do in class, Dr. Moody, is to talk about a preferences list or desires list, so that they can know and communicate with their healthcare provider what are the things they desire that will help make this birth the best birth it can be for them. And so in addition to talking about the list, we include that they should get up and walk and move and change positions.
Exactly.
And get out of the bed. So one of the tools that we demo in class is the birth ball, and showing them that not only is it an exercise ball that they've seen in the gym, but it's a great tool to use in labor, because it helps to widen the pelvis, and it also helps if they have back labor to kind of keep some of the pressure off their back and possibly help alleviate some of the pressure and pain on their
All
back.
right, so my question is, if you get an epidural, can you still use these tools?
The birth ball, you would no longer be
You wouldn't be able to.
use.
Okay.
However, they would be able to use this neat ball called the peanut ball.
Peanut ball.
Peanut ball.
I can only imagine the person who thought of the idea of using the peanut ball. It was fabulous.
It's incredible.
So when I show it in class and I demonstrate it, I talk about how with an epidural, they are then confined to the bed. And one of the things that we want to optimize a vaginal birth is to keep that pelvis open.
Okay.
And so when they lie on their side, the nurse will use this tool to put between their legs.
Okay, so you've got a knee and a knee up here.
Exactly.
Okay.
Exactly. And so you have optimal pelvic width that allows that baby to descend the way he or she should.
Okay.
So it's a great tool, and it's very daunting when we're in class and nobody wants to really practice this. But I tell them that their nurse is
Their
really
nurses are going to use it. The
this
nurses here at
upstairs.
Rex love the peanut,
Yes.
and
Okay.
we use it all the time.
Yes.
That's good to know.
Yes. And so in addition to the peanut ball and the birth ball, we have them in different sizes. So regardless of the height
Okay.
of the mom, we make sure we get one that fits their height. So if you're using the peanut ball, you want one that's going to keep your knees at a 90-degree angle lying on your side. If you're using the birth ball, you want one that is also going to keep your knees at a 90-degree angle.
Okay.
So that it's comfortable for them and they can easily maneuver up and down off of the birth ball.